You are out for your usual morning jog walk. The rhythm of your feet on the pavement is familiar, almost meditative. The first kilometer feels fine, but by the third, a dull tug starts to gnaw at the back of your ankle. You push through, thinking it is probably just tight calves. If this scenario sounds all too familiar, you may be experiencing the early signs of Achilles tendinitis. Whether you are a passionate runner, a weekend hiker, or someone who spends long hours standing, like teachers, lab technicians, or receptionists, understanding Achilles tendinitis is vital. Recognizing the condition early can make all the difference in maintaining an active, pain-free lifestyle and avoiding disruptions to your daily routine. Let us begin with a quick look at the Achilles tendon itself. The Achilles tendon is a thick, rope-like cord that connects your calf muscles, the gastrocnemius and soleus, to your heel bone, known as the calcaneus. It is the strongest tendon in the human body, yet it endures immense stress. During activities like sprinting or jumping, the Achilles tendon can be subjected to forces up to 7 to 10 times your body weight. Despite its strength, the Achilles tendon is particularly vulnerable to injury. This vulnerability comes from its limited blood supply, especially in the region 2 to 6 centimeters above the heel. The tendon acts like a giant elastic spring, storing and releasing energy with every step. However, repetitive loading without adequate rest leads to tiny micro-tears. Age-related changes in collagen and calcification can also make the tendon stiffer and less flexible, increasing the risk of injury. So how does Achilles tendinitis actually develop? The process is often gradual, starting with common culprits like a sudden increase in physical exertion, perhaps running longer distances, or ramping up workout intensity. Other factors include wearing unsupportive or worn-out shoes, training on hilly terrain or hard surfaces, limited ankle mobility, or tight calf muscles. Even previous injuries that alter your walking or running mechanics can play a role. Certain medications, such as fluoroquinolone antibiotics, and systemic diseases like rheumatoid arthritis, can also increase your risk. Achilles tendinitis progresses through several stages. In the early reactive tendinopathy stage, typically 0 to 2 weeks after overuse, you might notice acute tenderness, swelling, and stiffness shortly after intense activity. The pain usually eases with rest. If the strain continues, the tendon enters the disrepair stage, lasting 2 to 6 weeks. Collagen fibers start to disorganize, and the tendon may feel thickened to the touch. Chronic overuse leads to degenerative tendinopathy, with persistent pain, nodules developing along the tendon, and a higher risk of partial tears. Ignoring these early pains can make recovery much more challenging and prolonged. Spotting the early warning signs of Achilles tendinitis is crucial. One of the most telling symptoms is painful stiffness around the heel or ankle, especially when you take your first steps in the morning. You may also notice pain when climbing stairs or performing heel raises. There is a phenomenon known as the warm-up phenomenon, where pain at the start of exercise subsides mid-session, only to return afterward. If you experience swelling that does not subside within 2 weeks, an inability to perform a single leg heel raise, or a sudden pop at the back of your ankle, it is important to seek professional advice immediately. These could be signs of a more serious injury, such as a tendon rupture, which requires urgent care. When you visit a clinic with heel or ankle pain, your healthcare provider will start with a thorough history and physical examination. They will check for tenderness 2 to 6 centimeters above the heel and feel for any thickening or nodules along the tendon. Imaging studies like ultrasound can reveal tendon thickness and increased blood flow, while magnetic resonance imaging, or MRI, is reserved for complex or chronic cases to rule out partial tears. Preliminary assessment is often clinical, involving palpation to detect tears, gaps, or nodules, and range of motion tests to assess stiffness or restricted movement. The Thompson test, where the calf muscle is squeezed to check for foot movement, and the Matlas test, where the patient lies face down with knees bent, help identify possible tendon ruptures. Managing Achilles tendinitis effectively involves a combination of rest, exercise, and supportive therapies. In the early stages, self-care using the RICE protocol, relative rest, ice massage for 10 minutes 2 to 3 times daily, and temporary use of heel lifts or supportive insoles, can help reduce strain and inflammation. Exercise therapy, particularly eccentric heel drops, is highly effective for stimulating collagen remodeling and strengthening the tendon. To perform this exercise, stand on a step with your heels hanging down, rise up with both feet, shift your weight to the affected leg, and lower slowly for 3 seconds. Repeat 3 sets of 15 repetitions, twice daily, for 12 weeks. As the reference notes, exercise loading, not complete rest, is the cornerstone of Achilles tendinopathy recovery. Adjunct therapies such as physical manual techniques, gait retraining, and shockwave therapy may help reduce pain in chronic cases. Non-steroidal anti-inflammatory drugs, or NSAIDs, offer short-term relief, but do not heal the tendon. Surgery is considered only when there is a tendon tear. Homeopathy offers a holistic approach for deep and lasting effects, especially when inflammation follows excessive strain or overuse. While it can be used as supportive care after injuries or surgical repair, or can treat individually, several remedies are commonly prescribed, like Rhus tox is often recommended for overuse and strain, helping to reduce inflammation and relieve pain that is worse with first movement, but improves with continued motion. Rutagraveolens is used for aching, sore, or bruised pain in the tendon, especially with restlessness. Causticum addresses muscular pain in the calf and tendon, characterized by tearing or cramping sensations. Bryonia is suited for painful stiffness and soreness, with pain that increases on motion. Simitifuga helps with aching pain and stiffness that worsens with walking. Muriatic acid is used for marked swelling and heat in the calf and heel, accompanied by severe pain and difficulty walking. Benzoic acid is indicated when pain worsens with walking or pressure, while calibitrome helps reduce soreness and burning in the heels. Prevention is always better than cure. Increase your training distance or intensity by no more than 10% per week, and replace running shoes every 600 to 800 kilometers. Alternate high-impact with low-impact sessions during painful phases, and incorporate foam rolling, eccentric, and isometric calf exercises into your routine. Aim for at least 10 to 15 degrees of ankle dorsiflexion beyond neutral. Quitting smoking, getting adequate sleep, and ensuring sufficient protein intake all support tendon healing and collagen repair. Temporary relief comes from increased blood flow, but damage may still be occurring. Complete bed rest is not ideal. Controlled loading is essential for recovery. Achilles tendinitis can affect anyone, not just athletes. Remember, early intervention is the key. If your heel is grumbling, start self-care and consult a healthcare provider to prevent further damage.